Hello, my name is Dr. Sonny Afshar, and I've been a practicing dentist for 26 years. And me and my very talented and devoted staff, we've been helping thousands of patients realize their aspirations and dreams about having a healthy and beautiful smile. So I'd like to discuss with you a case that we did today on a very good patient of ours. He presented to our practice today for us to do our all-on-X procedure on the bottom, which includes the extraction of all the lower teeth, placement of 6 implants, and bone grafting. On the top, we went ahead and extracted the teeth and did our bone grafting. So patient comfort is paramount in our practice, and so we offer conscious sedation for our patients to make sure that they're comfortable. And the way we like to do this is, although I'm licensed to do this by myself, I'm so focused on my surgeries that I feel it's necessary to have a paramedic be here the entire time to monitor my patients' vitals and make sure they're completely safe. Once they're sedated and they're comfortable, then profound anesthesia is provided so that they have no pain whatsoever. As I had described before, during our phase 1, the pre-surgical phase, we create a surgical guide which navigates us to precisely place these implants in the sites that we want. So during our procedure, you will notice a guide being fitted on the patient's dentition, and that's what we use to place our implants in the locations that we want to ensure that the final prosthetic is going to be made properly. So the proper incision was made to expose the dentition. The teeth were elevated and gently removed. So first and foremost, I'm a dentist, and my job is to try to save and protect teeth when possible. There are cases in which teeth are non-salvageable and they have to be extracted. And in this case, the entire mandibular teeth had to be extracted. So first, an implant is surgically placed. Then prosthetic components are attached to the implants. And therefore we can attach a temporary or a permanent restoration to the implants that way. There are times where the bone is deficient or compromised, and therefore what we do is we actually have freeze-dried bone from a cadaver, and we're able to do some grafting to ensure that the mass and the quality of the bone is restored. So So CT scan then was taken to ensure that the placement was the implant was accurate, and the CT scan is going to give us a lot of information, so it's absolutely necessary for us to be able to have that in our office. The next step we have to do on the patient is to extract the maxillary teeth and do our bone grafting in preparation for implants down the line. The patient has decided to wait on the maxilla for the time being. So now that we've finished our surgical procedure, the patient will be getting a temporary that we fixate, and we're going to have the patient go with that for about 3 to 4 months until we're sure that those implants have taken and they're fused to the bone. At that point, what we'll do is we'll get the patient in and we'll remove the temporary, and we'll make a second temporary that is more cosmetic and is more acceptable to the patient's cosmetic needs and desires. Once we've obtained a temporary that is acceptable to our patient, both from a functional and cosmetic perspective, then we are ready to make a replica of that in the zirconia, which is a fabulous, beautiful restoration, one that patients can be very proud of. At Star Dental, our patients are a priority. We'd love to get to know you. If you have any questions, please do contact us. Thank you.